Well, you may know by now the Thompson Twins tune means a doctor is in the house. We're talking with another edition of Medical Minutes with Dr. Thomas Rogers from Cleveland Clinic Union Hospital. Good afternoon again, Dr. Rogers.
Hi, Kelly. Good afternoon.
Great to have you here. And our special guest today?
We have Dawn Abrams today. And Dawn is our clinical program manager over at Behavior Health, and we have some good things to talk about with her as well.
Fantastic.
And I'll introduce her a little bit about her life as well as we go.
Okay, as we are beginning this September very somber note here with Suicide Prevention Month, such a public health issue still. There was a benefit here in the Tuscarawas Valley over the weekend for suicide prevention. Dr. Rogers, how do you and Dawn Abrams even begin to address that situation?
Yeah, it really is something that's probably touched almost all of our lives at some point. And in those cases, you really remember it and you think, what could we have done? There's something we could have done to prevent suicides. And just here in Tuscarawas County from 2020 to 2023, there were 55 suicides, 17 overdose deaths as well. So we're not even really going to talk about that today. But even in 2022, 49,000 deaths in the United States. So it's a huge problem. And surprisingly, you think about, well, we only think about young people that die of suicide, but the oldest population, those over 85, have the highest rate per 100,000, and then those at 74 to 85. So over 85 have the highest rate, and then 74 to 80. When you think about that, right? A lot of our older family members that can be at risk too. So it's really is a huge issue, and really for Union Hospital, what we do, both on the primary care setting, the ED, and in behavioral health as well, we really look at as a family taking care of families. We want to address behavioral health issues. And you think about on the primary care side, many times 50 to 75% of the issues that people bring to us may be related to behavioral health. Not everybody comes in as suicidal, but we really want to be able to address those things today. So what's really awesome today, though, we do have Dawn Abrams. So Dawn was born at Union, so that's pretty cool.
Oh, wonderful.
And so we always love when our own caregivers were born at Union. A Claymont grad, went to Kent State for her nursing degree, and then delivered all three of her children here at Union Hospital as well. And has been with us for 5 years, and really has just been a great, and a lot of people don't think that we have behavioral health resources at Union, but we do, and we don't have an inpatient group, but what Dawn does and what she's going to talk about today is the services that she provides to really as that bridge for us to be able to utilize our care within the Cleveland Clinic system, but what she can do here on the ground as well. So Dawn, it's great to have you here today.
Thank you.
Yes, Dawn, welcome aboard here. WJER reminding us, our listeners, this is Medical Minutes, and Dawn Abrams, behavioral health, the whole umbrella, doesn't always require a lab blood test. You have a lot of other detective work to do. How do you think this local care with families helping families, as the mantra goes, how is the program functioning today?
We have been open for 9 years. Actually, yesterday, 9/15 was our anniversary. We've been open for 9 years. So
oh, congratulations.
Thank you. Behavior Health Center, we have an intensive outpatient program. Like Dr. Rogers says, we do not offer inpatient care, but we offer outpatient at a more intense level. So our patients are with us 3 days a week, 3 hours a day for approximately 4 to 6 weeks.
And again, not always inpatient needed. So you have many services that do provide the caregiving, but not within an inpatient situation. So describe that picture a bit.
Yeah. So with that, we have folks that'll come in, and when we do those assessments, we make sure that they are safe to be in an outpatient setting. But that is where they come in, and we have our intensive outpatient program that we have a combination of one-on-one therapy and group skill training sessions, and those are led by our therapist. And we also have medication management with our psychiatric providers.
And again, you need that continuum. You don't fix this in a day, should we say, but it can be helped. And I guess fix is not a very good word with the pervasiveness of really some depressive situations, and with behavioral health. Again, within a quick doctor's appointment, it may not be picked up. As Dr. Rogers mentioned, the percentage of our doctor's appointments, we know you're all in a rush. There's a lot to work in a medical day. But what about maybe a broken bone or a heart issue? Anyone can have a behavioral health issue. So are you willing to address men, women, children?
Absolutely. Our patients are men and women of all walks of life. We are only 18 and over, but we do have resources for children. But our patients blue collar workers, teachers, lawyers. We've had nurses. You know, a patient can be anyone. Our family, friends, colleagues. And with that being said, confidentiality is the utmost important to us. So we are committed to protecting that patient privacy, privacy of treatment, and patient identity.
Dawn Abrams, again, Dr. Tom Rogers. This is Medical Minutes, another edition with Suicide Prevention Month, September, all month long. But Dr. Rogers, you know, it's every day of every year. And how do we start a conversation if we have a loved one or a coworker or a fellow student who we think really may be needing some help, but they just don't have the strength themselves to come forward? What do you suggest?
Yeah, that's a great question, and a lot of times, especially what we used to do in the military, was one of the things we did was ask, care, and escort. So if you do have somebody who is expressing concern that you have concerns about suicide, and it could be any number of things. We talked about people giving away their possessions thing. That is true. That happens where people may start doing those things. If you see behavior which seems a little odd for that person, make sure that we're always ask them what's going on. And if you even ask them about suicide is not a bad thing. People think if I ask, they're going to do it.
We don't want to say the word.
No, but it's not true, right? We ask, care, and escort, get them to the care they need. And really the causes of that stressors for suicide and the things that give increased risk, things like financial debt, if you have financial problems, and family and relationship issues are probably the biggest thing. When we were in Iraq, it was so sad because many times you'd have a soldier literally could get off of the phone and then go in and it would kill themselves. And you couldn't do anything that quick. And it was almost always related to something that happened at home. So those relationship issues are probably, at least what I saw in the military, was the biggest thing that we see. And we still see that here in Dover and New Philly and across the country. And then lastly, behavioral health issues, just depression, any of those things, any behavioral health issue can increase your stressors or risk for suicide. And then substance abuse. We talked about the number of overdose deaths we had in 2023. Those can also really increase your risk for suicide. So the biggest thing is offering support, get the person to the care they need. So even we do here on the outpatient side, but our emergency department does a wonderful job working through our central intake to be able to get someone to the care they need within the Cleveland Clinic system. And it's really a great system. Sometimes it takes a little bit of time, but we watch you in the emergency department, make sure that you're safe. But the biggest thing, I think, that to your question, is just offer support and try to get the help that they need.
And I love the military mantra. Give us that slogan one more time again.
It was ACE. It was ask, care, and escort. And that way, because you never want to leave somebody alone. If someone, especially with the military, we used to have access to the weapons. You make sure you get the weapon away from them when we were deployed, and really get them to the care. But sometimes you think, oh, I'll go get help. Never leave them. But biggest thing is just see how you're doing. Are you doing all right? Ask for how they're doing. Provide that care, and then make sure you get them the help they need.
And even if there is someone on the other end of that conversation that's not very communicative, we're in the communications business, but it's not so easy for some. At least they know you care. They can tell when you're curious, like not just curious, but truly, genuinely care. And even asking, I think, can wake up a little part of the brain and soul and heart to let them know that you care. And if you haven't heard from them for a while, things like that. Dawn Abrams, Dr. Tom Rogers, amazing help in our community, and you say with everyone's help it is 100% preventable. We're talking suicide, September, National Suicide Prevention Month, and it's up to all of us to really wake up a little bit and care about our fellow workers, our students, family, friends. National Suicide and Crisis Lifeline, Dawn Abrams.
Yeah, 988 is the national
That's it?
lifeline for anyone that's struggling. Yep, you just text or call 988.
Can't be any simpler than that. It's time to make that call, especially this month, but any other time as well. And Dr. Rogers and Dawn Abrams, we're heading into the seasonal affective disorder, where it's really every time of year that can create its own mental health pressures. And again, the behavioral health program with Cleveland Clinic Union Hospital. Our topic today on Medical Minutes. Dr. Rogers, Dawn, anything else?
I think that the awareness that mental struggles can, they don't discriminate. It can affect anyone. But suicide is 100% preventable. We have resources at the center. We have resources in our community that are available, but there is hope.
There is hope. Dr. Rogers, thank you so much for bringing in Dawn Abrams. We're going to have to get you on the air with our special segment of your service in Iraq. So we thank you again for your military service. You'll have to ask Dr. Rogers about that. It's quite the story. Pentagon, and we get you here in Dover, Ohio. So thank you again for another edition of Medical Minutes. Keep up the great work.
Thanks, Kelly.
Thank you.
Thank you so much. This is Monday, September 16th. You have been listening to a very important Medical Minutes.